first, I'd like to thank everyone who's working in healthcare for all their hard work and dedication and professionalism. From front door screeners to the staff that cleans and disinfects the rooms and equipment, from nurses on the floors to my colleagues in the emergency department. Second, I'd like to thank all the members of our community who are doing their role, staying at home, helping neighbors who are at need, and washing their hands. There are many similarities between the COVID-19 crisis and the climate crisis. Both are truly global. All will be affected. Both crises do not respect borders or politics. And different areas will be impacted at different times in somewhat different ways. Both these crises impact the people most vulnerable, the old, the poor, Indigenous populations, those with chronic diseases. Both have been predicted by science. Both require solutions based on science. Also, to deal with both, people must work together for each other. We must make significant changes in how we live and how we get about. There are tremendous valuable lessons to be learned from the COVID-19 crisis to help us prepare for tackling the climate crisis. It's almost like an exhibition season, and the real season is to come. We have demonstrated that we're capable of responding with innovative thinking, with compassion, and with great speed. I hope we'll be able to build on the lessons that we're learning from this terrible pandemic, and that will allow us to be much better prepared and to prevent the climate crisis and the implications that that will bring. We're seeing wildlife returning to all kinds of places that they weren't there before. We've seen from outer space the clearing of pollution over places such as India and China. And we've seen how quickly the Earth can respond if given the chance. So I think that this is one of the lessons that we can learn from COVID, is that the Earth has the capability to correct things if given the opportunity. And it also shows, the example of air pollution in China, statistically, more people died from air pollution than have died from the COVID-19 pandemic in China. Well, I think one of the big lessons is if we work together, we make a huge difference. So I think that's the first thing that we should recognize. The second thing we should recognize is that governments have the capability to respond and to make hard decisions and make tough calls in a time like this. And the same thing would apply to the climate crisis and what they're doing for COVID. As an example, we're getting a huge infusion of finances and money to all sectors of our life, and we're going to be making decisions about how to use that money moving forward. My hope would be that people will pause and say, can we use this infusion to build a better future for ourselves, for our children, for our grandchildren? Should we be moving away from fossil fuels in a nice transition? Should we be using this finances to move to a more sustainable, greener economy? We have the opportunity to make those decisions now. I think we can keep many of the things we do very simple. We talk about staying 6 feet away from people, physically distancing. We talk about washing your hands frequently. We talk about just covering a cough in your sleeve, all these simple things. Well, there's simple things that we can do as individuals to focus on the climate change. For example, we can work really hard not to use single-use plastics. Now that we're standing 6 feet apart in the grocery store, maybe this is a time to take those bags in and use them and not use the plastic bags anymore. We should be changing a little bit how we eat. Maybe because we've been staying at home and not going out so much, maybe we can have a meatless Monday. Maybe we can move to more plant-based proteins, changing our diet. We're definitely going to be out walking and using bicycles more. I think that's going to help. And then we need to, again, work together, support groups in our communities that are interested in tackling the climate crisis, whether it's people like Living Greenberry or the Simcoe Green Belt. There are lots of organizations that need supports from individuals. And then finally, the most important tool we have is to influence our elected officials to move in the right direction. It's a long way away before we get to vote again, but a letter or an email, a call to your local municipal representative, your provincial representatives, and your federal representatives, and tell them that we need to use the changes that are occurring now to also deal with the coming climate crisis. It's very important that they hear from us loud and clear. We definitely know that with the warming of the climate, there has been a movement of diseases into areas where they weren't before. A good example would be the movement of Lyme disease, which is carried by ticks, that has moved from the northern part of the United States now into Ontario and is as far north as Barrie itself. Zika virus, which everybody remembers around the Olympics, also is a factor of the changes we've done in the climate. But we do know that because we've been encroaching on natural wildlife and the interaction between people and wild animals and the animals we use, such as poultry and pigs, there is a breeding ground for new viruses. And that probably has played a significant factor in the development of this novel virus. A virus that is completely new. Nobody has any immunity to it, maybe other than bats. And because of that, has spread so rapidly and quickly throughout the world. Yes, if we don't take steps to deal with this issue, there will be more pandemics coming down the road. Nobody has any immunity to it. And eventually, whether it's through being naturally infected and surviving and get immunity, or we hang in there long enough that we can develop a vaccine, we don't have a lot of tools at this point in time. The only real tool we have to fight the coronavirus at this point in time is to not let it have a host, not let it live somewhere. And it doesn't move on its own. It has to be moved from one person to another person, and that has to take place within 6 feet. So the first thing we've done by all this physical distancing is to buy us time. And there's a number of things that we have to buy time for. One, we were caught a little bit unprepared for protective equipment for our healthcare workers, our frontline people. We need to buy some time in order to build up those stores to be in place so that we can protect and look after people as best we can. Second, we need to buy time to get test kits and swabs and laboratories in place so that we can rapidly and quickly test, as they have done in places like South Korea, Singapore, and in China. By being able to test large number of people, we'll be able to go on the offensive, find where a virus is, shut it down in that area by quarantining anyone who's around that person who's tested positive. Then we can start limiting the number of people that have to be on lockdown. You're right. As we ease off lockdown, we'll have to monitor very closely where there's outbreaks. And so to be able to do that, we have to have lots of tests and the ability to test quickly and get results quickly. Finally, when we do get a vaccine and we do possibly get some medications that will help with this treatment, we will be able to let the lid off a little bit, and we'll have to monitor it very carefully. Historically, when pandemics go through, they usually come through in waves. One initial huge peak, and then a number of waves afterwards, a second or third, that may come 3 to 6 months afterwards. Right now, the only tool we have is physical distancing. The other tools will be coming on board very soon. So I think that how long will the lockdown last? The truth is, life may never go back exactly the way it was before. If you remember 9/11 and the changes that have occurred in our world as a result of that, we never went back to the way things were before. Going through airports was completely different. Traveling around the world was completely different. These kinds of things create a new normal. But the new normal doesn't have to be always bleak and dreary. The new normal could be a much better place for for the people who live here. This is an opportunity for us to create a much better world, building on what are the best things of humanity. Fairness and equity, mutual aid, inventive thinking, a green, sustainable economy, and being in harmony with the world we live in. I can't emphasize enough the importance of people listening to the scientists, listening to the leaders who listen to scientists, and doing what they can on their front. There have been many times in history where people have had to tighten their belts a little bit. World War II, during the Blitzkrieg, people had no lights at nighttime. Kids were moved out of their homes into the country. A lot of things changed, but the British, the Londoners, they were able to get through that by working together, looking after each other. If you compare what they had to go through with us being able to sit at home with Netflix and Zoom meetings and that sort of thing, we should be able to do this. And there are many things that people have put aside that they're starting to do again. Having meals with families, playing with their kids, actually learning how to educate their children. There are a lot of very positive things that have been forced on us by this event. And we are going to get through this.